Hi everyone, welcome to Lesson 1.2, Theory Development in Leading, Managing, and Following. I've provided on eClass a theory box which provides an overview of the key leadership theories, from trait theories of the early 1900s to current transformational leadership theories and authentic leadership. Transformational leadership theories and authentic leadership represent a shift in thinking about leadership, management, and followership from a task focus to a relationship focus. And that's because healthcare settings are more complex, demanding, and they're constantly undergoing change to meet population needs. As well, nurses are plagued with stressors from workplace demands, and so leadership styles have been changing. And so, as I said, leadership styles can be either categorized as relational or task focused. And both types of leaders need to achieve workplace goals, but their focus is either on the quality of relationships among their followers, which are relational leaderships, or on tasks, specific tasks that must be completed, and that's task-focused leadership. And so the first three here are more task-focused, and the last two are more relational leadership. So from the theory box, you'll see the theory called trait leadership theories. These are theories from the early 1900s, and they came out of this whole great man theory of being born with leadership traits. And the key idea is that leaders have a certain set of physical and emotional characteristics that are crucial for inspiring others. And these leaders had traits of self-awareness that was useful for assessing their personal strengths. And we see that in our leaders today, the importance of self-awareness. Style leadership theorists looked at or considered how leaders behave, and they were based on two types of behaviors, either a task or a relationship behavior. And that's what I discussed on the first slide, is looking at that transition from task-focused to more relationship-focused behaviors. But in this theory, the style leadership theory, it started to develop that transition where leaders needed to have both types of behaviors to be successful, both a task-focused and a relationship-focused. Situational-contingency leadership theories, these are leaders that focus their leadership effectiveness dependent on the situation or the context. And the theory behind this was a path goal theory. So there was a path and a goal getting to the end. And so the leader's behavior was kind of contingent on the task and the follower characteristics. Nursing leaders must assess each situation as unique and determine appropriate actions accordingly. And so again, if you go back and look at the theory box that I provided, that tool or that box gives you some ideas of the nursing implications for practice. And so these leaders were more recognizing that you needed to change your leadership style based on the situation or the context. And then moving into transformational leadership theory, transformational leaders are relationship focused, and they possess four specific characteristics. So two of the characteristics, idealized influence and motivational inspiration, are associated with charisma or the capacity to mobilize large groups or followers. And these leaders are able to share their vision and ideals in inspirational ways. The other two characteristics, individualized consideration and intellectual stimulation, are more commonly seen by transformational leaders when they are with individuals or small groups of followers. And so in these instances, they are attentive and respectful listeners, and they engage with their followers to examine the problems at hand and find solutions together. And the research shows that transformational leaders are trusted and admired, and their followers will go above and beyond typical work expectations. Research has also found that transformational nurse leaders are associated with greater job satisfaction and autonomy among nurses. And these leaders are also associated with better patient outcomes, including lower morbidity and mortality rates and greater patient satisfaction. Some research out of the US found that there was a positive association between nurse leaders with transformational leadership styles and their levels of EI. So remember emotional intelligence from our first lesson. And it indicated and it showed that how emotional intelligence and self-awareness and the ability to be able to regulate your emotions were important attributes for building and sustaining positive workplace relationships with followers. So you can see this transformational leadership theory and how we see it in today's leaders. Another type of leader is the transactional leadership. And this is more of a focused on manager type style. And so, but you do see some of this in leaders as well. And so this is a task-oriented leadership style, and followers with these type of leaders know what to expect of themselves by their leaders. And so they know what the expectations are. Followers have clearly defined rules and accountabilities. They receive the necessary resources and support to do their work, and they know they will be rewarded for work well done. And so transactional leaders must be present to recognize if their followers have work-related needs and to monitor work accomplishments. So you can see that's more of a nurse manager role. And lastly, authentic leaders have heightened awareness of themselves in relation to others around them. They have this internalized moral perspective, and they align their words and their actions to match their underlying values and beliefs. So they're not swayed by external pressures, and they apply balanced processing or the thoughtful consideration of all the evidence available to them. And they are transparent and open to others. And this is called a relational transparency. And so there's some research that has looked at authentic leadership, and it's been positively associated with nurses' job satisfaction and self-rated performance. And it's also been associated with lower turnover among new nurse graduates in environments where the nurses had authentic leadership theories or styles. And so that is, those are the 5 main leadership theories that I wanted to cover, and we'll look more at these when we focus in on week 2, when we look at these in more of a leadership style. So if we look at management theories, there are a lot of different ideas of management theories. Management theories came out of the industrialized revolution. So in the 1940s, these management theories came out of scientific management, where you were looking at the efficiency of organizations, the efficiency of workers, labor division and specialization, systematic analysis of the relationship between workers and their assigned tasks. There was this development of written standardized procedures and close observations and good rewards for workers that did good work. And it was also focused on the worker selection was based on the right skills for the right task at the right time. And so that's kind of similar to what we see with CNO and RPN versus RN scope of practice. In 1990, Henry Mitzberg, who is a Canadian academic in business and management, wrote extensively on hospitals and healthcare organizations and the organizational processes and structures that come into play. And so a lot of the work there was looking at the standardization of work processes, inputs and outputs, worker skills and knowledge, organizational norms, and again, really much looking at this organizational and structure and how people manage. And so one of the tools that we will look at is called the Lean tool, L-E-A-N. And what it is it's been used by Toyota Automobile Manufacturing as a management tool looking at their organization and their factories for productivity and efficiencies. And a lot of healthcare organizations are now looking to use these lean tools to improve the province's healthcare settings. And then lastly, fellowship theories. So our understanding of fellowship is evolving along with our understanding of leadership and management. And so in the literature, the trend has been focused on replacing the term follower to the term team. So replacing follower terms with team terms because of the importance of effective teamwork within our complex healthcare environments. The fellowship theories are based on the follower's desire for self-enhancement and self-protection. Other researchers look at followers as actively contributing to organizational success, and that a follower is it's more of a role rather than a person, and it's got specific characteristics such as effective followers are active, not passive. Effective followers share the same goals and purpose as leaders. And there's an effective relationship between followers and leaders, and it's based on this interdisciplinary and interdependency, mutual trust and respect. And so a lot of research is coming out about the promising area of the importance of a leadership fellowship dual or dyad, and investigates how leaders and followers interact with each other. So what patterns of leading and following work well together. And another area of investigation is non-following. And there are many occasions when leaders fail because no one responds to their calls for actions. And so in these instances, outcomes are attributed to ineffective leaders or low quality leader-member relationships. But new research is looking at, like, what about the follower attributes and behaviors that contribute to leader failure? And is it something related to a non-follower attribute? The last theory I want to focus in on is complexity science. So this is coming from the premise that leaders, managers, and followers do not interact in a vacuum. They are significantly influenced by their work environments. And so one of the most important branches of new science that is devoted to complex systems is complexity science. And it began with chaos theory and the physical and mathematical sciences. And since then, the social sciences and healthcare have adopted complexity science principles to better understand the nature of relationships in complex social systems, such as complex healthcare environments. And so complexity science views systems holistically. It considers the whole to be greater than the sum of its parts, and we see that with Watson's theory as well. And so the world is full of systems within systems that interact and adapt through relationships. The interactions may appear to be random, but patterns emerge over time. And so complexity science offers nurses a new way of understanding the complex patient and family dynamics, teamwork within organizations, and even health and well-being. An important premise of complexity science is that human systems can adapt well to complex situations, often finding their own creative solutions to problems when controls are relaxed. Healthcare organizations are complex, adaptive systems where the individuals interacting with them are interconnected, always changing, and unpredictable. Over time, patterns of interactions occur among individuals who find the best ways of doing work and solving problems together. So these patterns are observable and can be used by leaders to get a good enough appreciation of what's working or not working within their practice environments. So complexity science thinking really stands in sharp contrast to traditional systems thinkings, which focuses on developing these elaborate plans and specific details on what must be done at every level in an organization. But in organizations that follow a complexity science approach, traditional organizational hierarchy is replaced with decision-making distributed across the organization. And so at the practice level, for instance, complexity science encourages healthcare providers to loosen their control over patients and families. Every voice counts, and every encounter between and among patients and staff contributes to effective decision making. And so this is our premise from patient care advocates and patient-centered care. And so nurses must be flexible and dynamic to keep up with the ever-changing systems of people, healthcare, public policy, and human relationships. And so that's the premise behind complexity science. So coming up next, we will discuss leading, managing, and following competencies.